Thank you so much for joining us for this month's Cedar Talk featuring Chelsea Clinton. As a reminder, Cedar Talks is a monthly thought leadership series focused on highlighting experienced entrepreneurs, tech innovators, and healthcare leaders who are solving important problems by challenging the status quo. Today's virtual event will conclude in approximately 1 hour, and while our speakers can't see or hear the audience, please feel free to use the chat function in the Stage tab to post questions or comments. We'll aim to save a few minutes for audience questions during the end of our conversation. Now, 2 quick plugs before we get started here. If you like what you see on the Cedar Talks, please look for future Cedar Talks, including speaker Paul Ryan, who's joining us on March 16th, and Max Levchin, the CEO of Affirm, on March 25th. You can join our mailing list via Cedar's website, which is www.cedar.com/Cedar-Talks. Also, Cedar is hiring, and we have a very talented and charismatic recruiting team available to answer any questions you may have about careers at Cedar. To get in touch, you can just hop over to the Expo tab and start a chat if you're so inclined. Okay, now that I've gotten the logistics out of the way, I'm pleased to introduce this afternoon's participants. Leading this interview is Cedar's co-founder and CEO, Florian Otto, and I'm ecstatic to introduce today's thought leader, Chelsea Clinton. She's the vice chair of the Clinton Foundation. And as vice chair, Chelsea works alongside the foundation's leadership and partners to help create economic opportunity, improve public health, and inspire civic engagement and service across the United States and around the world. In addition to her foundation work, Chelsea also teaches at Columbia University's Mailman School of Public Health and has written several books for young readers, including the #1 New York Times bestselling book, She Persisted: 13 American Women Who Changed the World. And Chelsea, I also understand that you were a Girl Scout when you were younger, and you're a lifetime member, and that you've partnered with the Girl Scouts several times on various events and initiatives. And today we have a few members of Girl Scout Troop 2201, shout out, listening today, including my daughter Parker, who's here. She wanted to drop in and say hello.
Hi.
So anyway, thank you for being here with us. The girls in Parker's Daisy Troop are around 6 years old. They're working their way through their World Thinking Day Award and are learning about how female leaders build peace through inclusivity, education, and equality initiatives around the world. So thank you so much for joining us today and sharing your experience with us, including some of our future leaders. Florian, take it away.
Thank you so much for the warm welcome, Bethany, and of course, Chelsea, for joining. It's great to have you here. I think many of us here are interested to learn a little bit about your interest in healthcare. I think you entered college intending to study medicine, before then switching to history, then ultimately pursued a graduate degree in international relations and public health. Can you just talk a bit more about that journey?
Sure. And Florian, thank you so much to you and to Cedar Health for having me. And thank you, Bethany, for that warm introduction. And it was fantastic to see Parker briefly. And Florian, I will answer your question. I just have to say, though, I am very proud to be both a Brownie and a Girl Scout alum and lifelong member of kind of all of the really kind of wonderful experiences I had as a child. And I am so thankful that my parents supported my curiosity that kind of stretched into so many different directions. And kind of the only rule was I had to finish what I started. So if I signed up to an activity and it lasted, a month or a year, I had to see it through. Of all of the things that I was so lucky enough to do while I was growing up, the Girl Scouts were especially important to me. And I just kind of think about those lessons, including the lessons of persistence and kind of working toward my badges individually and collectively with my troop really often. And I also have to say that our recent order of Girl Scout cookies arrived. And so a lot of gratitude for the Girl Scouts in our house during kind of this moment while we're staying separate and apart. Kind of the Girl Scout cookies just seemed especially sweet this year. So thank you, Bethany, for welcoming the Girl Scouts here and for including Parker. Florian, When I was 11, I have this really vivid memory of watching on live television Magic Johnson talk about being HIV positive and talk about how important it was to him to actually talk about his diagnosis. I know that sounds like a little bit like a kind of tautology or repetitive, but just the courage and the compassion, the humanity that he displayed that day just has stayed with me throughout my whole life. And so kind of that really started my interest in the AIDS crisis. And yes, I came to Stanford pre-med and kind of completed all of my kind of biology and chemistry classes, and actually think I was just one physics class shy of completing the battery of pre-med requirements. And yet while I was at Stanford, I was lucky enough to take a couple of classes that were really about today what we would probably call health systems and the social determinants of health. And I got really interested kind of in what happens to help either kind of promote or depress kind of people's ability to be healthy beyond kind of the patient interactions. And I got particularly interested kind of for those questions in the context of HIV/AIDS. And so while I later, focused on history, I focused on kind of more modern history. Then I don't think I actually took any classes in ancient history or kind of anything that predated a kind of couple centuries ago. And then went and did my master's in international relations with a focus on international organizations and especially those that relate to health. And then a handful of years later went back and started, and then admittedly a few handfuls of years after that completed my doctorate in international relations. And I focused on really kind of a decadal look at the global fund to fight AIDS, tuberculosis, and malaria, and kind of really two questions, kind of one, a set of questions as to whether or not it had kind of lived up to its kind of foundational objectives, and then two, kind of what, if any, kind of visible effects that it had on kind of the broader development assistance architecture, and also kind of the broader kind of conversation around HIV and AIDS. And so I'm incredibly thankful for not only the history classes I took at Stanford, but for some more of the kind of systems thinking classes I took at Stanford. But I have to say, arguably the most important class I took at Stanford was statistics, because that really helped me kind of understand what sort of questions I wanted to ask, really helped me, I think, maximize my subsequent master's in public health, and also then kind of really do the type of doctoral work that I wanted to do. And I'm so thankful that now, goodness, I've taught at the Mailman School of Public Health at Columbia now for about a decade. And I am so grateful for so much of what I get to do in my life. But one of my most kind of favorite parts of my life is the mentoring I get to do of students who are now themselves embarking on their journeys with their kind of master's projects, or those who are kind of beginning to think about their dissertations.
Yeah, thanks for sharing that. I think a lot of people here in this audience are definitely passionate about healthcare, and I think everybody has been sick already, probably in the past, and the only thing you really care about is getting healthy, and addressing that problem from a bit more macro perspective is definitely very motivating. And as you mentioned, statistics is extremely important. And it's extremely important also not to forget the individual, to get the motivation out of it. So really appreciate, of course, all of the work that you're doing there. Maybe the second question would love to hear is the Clinton Foundation is focused on improving the lives and using tenets such as economic opportunity or public health. What are some of the economic benefits that can result from investing in public health?
Well, I mean, arguably, Florian, we're living through the kind of most painful example of what happens when you don't invest in public health. I've really been so frustrated, as I'm sure, that's very presumptuous, but I am sure, kind of given you said who is likely on this call with us, I'm sure that kind of many in the audience today, would share, or at least understand kind of the frustrations of kind of the framing that too often over the past year has put kind of public health and the economy kind of at opposite ends of an argument or of a spectrum or of a barbell, kind of however it's being framed, when actually you need robust public health to ensure that we can have a robust economy. It is not, the measures taken to protect kind of public health that have hurt the economy. It's the underlying virus that has kind of necessitated those measures, and arguably the failure, at least here in the United States, to implement those measures as soon as I would argue they needed to have been done so last year, and also in a more kind of coherent fashion than we were able to do here in the United States, at least. So, I certainly think we're kind of living through this example. We also have, now quite literally decades of research that prove how important kind of widespread use of, just taking like one example, of insecticide treated bed nets are in areas that have a high malarial prevalence, not only to help save lives, especially save kids' lives, but to ensure that there isn't kind of lost economic opportunity here in the future. Meaning, if kids don't get sick, that means their parents can go to work. It also means that they can go to school, stay in school, and then kind of they themselves be more economically productive over time. And while I certainly wish that kind of the moral exhortation that kind of everyone deserves kind of the right to health, and kind of the right to access healthcare, and the right to live in a place that kind of invests in public health, we know that those arguments have not been sufficiently persuasive. And so economic arguments have become more important to help catalyze and marshal funds to be invested in public health concerns, especially at a global level. And then just the last thing I'll say in answer to your question, Florian, on this is arguably the greatest kind of return on investment, I guess, if you will, really do come in childhood immunizations. Kind of really now enormous work showing, kind of that a dollar invested in childhood immunization coverage, is returned kind of many tenfold over. So, I end on that note because we've had quite a recession of childhood immunization coverage over the last year, as kind of large scale mass vaccination campaigns have been halted around the world, kind of in reaction to or due to COVID-19 concerns. And we really will need kind of the injection of an effort to catch up effectively those vaccination campaigns, because we don't want to lose kind of the coverage for children kind of today, and also then we don't want to kind of lose the future opportunity for those children, for their communities, or for their countries.
Yeah, I really appreciate you saying that everybody should have access to healthcare. I, of course, come from a country where universal access to healthcare, so you don't need to pay for that, which, of course, I think is super important. And in my opinion, it's not that you're spending more for healthcare as a society, but you're actually spending less for that. That's, I think, the interesting piece to learn from it. Maybe switching gears a bit, and I think you spent your career in both the public and then the private sectors. How do you see the public and private sectors working together to improve public health outcomes?
Well, I think, again, we're living in a kind of massive real-time case study of how that can happen. I mean, if we kind of think about just what has even happened in the last 24 hours, Florian, we had the first vaccine doses arrive on a Emirates airplane, kind of, AstraZeneca doses on an Emirates airplane from the COVAX facility, which is a partnership between kind of CEPI, WHO, and UNICEF. And CEPI itself is a partnership between the governments of kind of Norway, India, kind of the Gates Foundation, and other kind of not-for-profit partners. And so just even in kind of that one photograph of kind of the plane landing, in Ghana, kind of you had the kind of emblematic kind of the partnership that had led to that moment. And so while I certainly wish that had happened, 6 weeks ago, I'm really kind of thrilled that the promise of the 1.2 billion doses that COVAX has said it has secured, really now is starting to materialize, because I think that if we only kind of vaccinate the wealthy world, if the wealthy world only vaccinates itself, I guess I should say, kind of more accurately, we all will continue to remain vulnerable, not only to the variants that kind of we already have seen emerge of COVID-19, but those that will continue to emerge as the virus circulates in parts of the world where kind of there isn't robust kind of vaccination efforts underway. And so I strongly believe that we need to be kind of emphasizing more kind of vaccine equity and kind of equity at the kind of central part of how we think about vaccination efforts in this country, but also really at a global level, and hope that what we've seen just over the last day is the beginning of kind of that starting to happen. And then I hope that Florian, really unlocks the space for what my colleague and someone I admire so deeply, Wafa Al-Sadr, who's kind of one of the kind of world's leading HIV AIDS doctors, and really kind of doctors of global health practice at Columbia, has really been advocating since the beginning of the year the need for not only kind of the transfer of intellectual property around kind of making these vaccines kind of more broadly around the world. So kind of thinking about the kind of the Salk model of the polio vaccine from more than 60 years ago, but also the need for the wealthy world to invest in building manufacturing capacity, especially vaccine manufacturing capacity around the world, to try to help shorten the timeline of kind of when a vaccine is not only discovered but is proven to be safe and effective, kind of when that can be not only kind of manufactured in one place, but hopefully manufactured in a more kind of equitable way geographically, and then that will facilitate more equitable distribution. And so I'm really grateful for her and Peter Staley, one of our great kind of HIV/AIDS activists, and others who really have been making this point consistently now over the last weeks, because I hope that that's work that COVAX, kind of once it kind of is through this first hurdle of distributing vaccines around the world to low and middle income countries, will be able to kind of make the enlightened self-interest argument to the wealthy world as to why it is something that we all need to kind of be advocating for, and hopefully the Biden administration will be leading on.
Yeah, we are definitely very hopeful for that. And I definitely want to return after to the vaccines and, of course, COVID-19 as well. Maybe one more questions about public health would be, you've taken a special interest in promoting early brain and language development through the Clinton Foundation Too Small to Fail initiative. How does supporting childhood development lay a strong foundation for public health? And of course, in light of COVID-19, what are your thoughts on how we might better support children and their families during the pandemic?
Oh, goodness, Florian, that's so many questions under kind of one aegis. So before I became a parent, I guess I should start there. Before I became a parent, I knew the science about early brain development. I knew that 80% of our brains were built by the time we're 3. I knew that unfortunately, 60% of American kids show up unprepared for kindergarten because they haven't been in language-rich environments. Oftentimes, parents, grandparents, caregivers who, of course, want the best for their kids and the kids in their lives don't know how important it is to read, sing, and talk to their kids in any language. We have many parents who think if they speak to their children in one language, it may impede their ability to later learn English, here in the United States. And yet the opposite is true. Kind of the more they're hearing in any language or languages, the more likely they are to be able to subsequently learn languages and to flourish intellectually, academically, and also social emotionally, because kind of that brain scaffolding really helps kids then in some ways talk to themselves and listen to themselves and understand themselves. And so Florian, I was aware of all of that before I became a parent. And then when I became a parent, I saw kind of real time in my own life the wonder and the joy, when my kids would learn words and when they could start to express themselves and start to ask questions and kind of engage in conversations. And so that just really only kind of further strengthened my commitment to this work. And so, at Too Small to Fail, we really try to meet parents and caregivers wherever they are. And that has shifted certainly during COVID-19, but in a pre-COVID-19 moment, that meant, a partnership with the National Diaper Bank Network, kind of in which we kind of would give out books along with, diapers. That actually still has continued during COVID-19. And we've built a series of mini libraries in laundromats, because many families spend hours a week in a laundromat. So to try to help make that be productive learning time for kids. One of I think actually the last trip I took before the world shut down last year, I was trying to think of what was the best description, but
changed indefinitely. Yeah.
Yeah. Or at least we shut down, certainly in our family, was to Wisconsin, where we were where we had our first kind of library in a family court, and we're kind of starting to build libraries and kind of child play spaces in family courts, so that for children who often have to spend hours waiting with their parents or their caregivers in a family court waiting room, now have things to play with, kind of a warm environment, and books to read. We've worked with grocery stores to have prompts in the produce aisle to talk to kids about the colors that you're seeing in the produce aisle. We've worked with playground manufacturers to have story prompts or prompts to talk to children about kind of the play they're engaged in on playgrounds. We've worked with faith leaders for how kind of they can encourage their parishioners to, whether it's through kind of Bible stories or something else, continue to talk to their kids kind of throughout the week in ways that feel comfortable and natural, and hopefully not kind of out of sync with what they're doing. Kind of along those lines, we have developed and distributed kind of tens of hundreds of thousands of kits to families to help prompt kind of read and sing and talking while changing diapers or doing the dishes or kind of giving a bath, kind of that any moment can really be kind of a language rich moment with kids. And now during the pandemic, we've shifted our work, in Too Small to Fail, as we've shifted our work across the foundation and kind of all of our programs to either focus on COVID-19 or at least to react to COVID-19, where our work with the National Diaper Bank has continued. We have new work now with World Central Kitchen to distribute books at some of their feeding sites, including in Little Rock at the Clinton Presidential Center, which has been the largest feeding site in Arkansas over the course of the pandemic. We also have tried to kind of help make it easy for parents to think about creative ways to engage their kids at home. So we've done all sorts of kind of toolkits and suggestions around kind of everything that can happen with a cardboard box. So kind of lots of things, Florian, that have reacted to this moment, and some things that have kind of continued through this moment.
Interesting. When you do you have any good suggestions right now for young parents? I know a lot of our colleagues are having either newborn or toddlers right now at home. What are the one or two or maybe three things that you're doing with your family during the last 11 months right now to really encourage the kids to learn and to adapt to this new situation?
So I think, Florian, my husband and I realized at some point fairly early on in the pandemic that we were incredibly grateful that our youngest, Jasper, who's now 19 months and has spent the majority of his life, just with his family, candidly, that he had his big brother and big sister, and that they thankfully love him. While Charlotte and Naden, our two oldest, may have moments where they are frustrated with each other, they love their baby brother. And they kind of both have really learned to read and have become really good readers over the course of the last 11 months. And they read to Jasper, which has been a real joy. We found that playing games and doing puzzles and having things that we can do as a family has been really helpful. So we've played endless games of Uno and Rat-a-Tat-Cat and Sleeping Queens and Spot It and all of these kid-friendly games. And we've also listened to a lot of audiobooks, which has been really fun, that it's not just kind of me or my husband reading to them, or now as much as we love kind of them reading to us, that we kind of can all have the same experience of listening to an audiobook together. We're right now listening to the Beverly Cleary Ramona books, read by Stockard Channing, and they are fantastic. I highly recommend them if like anyone listening thinks their kids might be interested, or anyone listening thinks they might be interested themselves. I read the Ramona books as a child and just like loved them, and they are such a delight to listen to. And also, Florin, we have many nieces and nephews. My husband's one of 11. And so it's also, yeah, I saw your
Yeah.
also nice to have audiobooks, or kind of when our kids are, if they're watching something, like they watch the Carmen Sandiego series, like over many weekends, it's nice that they can still have somewhat shared experience with their cousins, so that like they'll be listening to the same audiobook, or they'll be watching the same series, so that when we get on kind of family Zooms together, it's not the same, obviously, as having like a shared play date, or a shared meal, or a shared holiday together. But I think it's still nice that they kind of have something they're each doing individually, but then they can get together and talk about it together. Has been certainly not a substitute for what we wish we could all have at this moment, but has been really a joy to see that they can still bond over kind of something they both have done, or they all have done.
Yeah, it will be interesting to see when we are looking back, I don't know, in a few years or so on this time, whether you, for your family, it maybe have been a very amazing bonding experience, because you probably never spent that much time with your family, because you right now don't travel and you don't go for other meetings. So of course, there's definitely one of the aspects that is, I think, very positive. And when we look back, that definitely might stand out. So
Yes.
I'd like to switch back a bit. Of course, we need to talk about COVID, because that's, I think, for public health, definitely one of the most infamous topics, and we just need to really try to learn from it, because it will not be the last of these pandemics that we probably will have in our lifetime. And I think one of the major hurdles in fight against the COVID-19 is misinformation around vaccines. What are some of the successful approaches to combating these falsehoods, and what can healthcare providers learn from this approach?
Oh, Florin, I think there was another big kind of new report actually that came out today that tried to not monetize, that's not the right word, I guess, kind of calculate or assess the monetary value of vaccine misinformation to Facebook over the last couple of years. So kind of inclusive of COVID and a little bit, pre-COVID. And not surprisingly, it is, a very high number. And I start there because I am incredibly, I'm thankful that Facebook finally has taken a more vigorous approach to misinformation around COVID-19 and misinformation about COVID-19 vaccines. I also, though, still admittedly harbor a lot of frustration, because kind of pre-COVID, I, among many others, had asked, kind of beseeched the company for many years to take a more pro-public health, kind of science-based, fact-based approach to regulating and then to deplatforming misinformation about vaccines, especially. In 2019, the United States almost lost our measles-free status, because we'd had so many measles cases and clusters across different parts of the country, because we had unfortunately so many parents who were not inoculating their children against measles. I have said for many years, and will continue to say, I think that Andrew Wakefield is one of the kind of insufficiently recognized villains of our time. Andrew Wakefield, who is now the disbarred medical doctor, who more than 20 years ago published a paper in The Lancet purporting to show a relationship between the MMR vaccine and autism. He lost his medical license in Britain, and the paper was later retracted, because not only could no one replicate his study findings, it later emerged that he'd had a commercial interest in kind of a competitive kind of early stage version of a measles vaccine, and that he had falsified his study results, and that his data was fraudulent. And yet, unfortunately, despite kind of all of that subsequently emerging, he has created quite a profitable career for himself as a purveyor of vaccine misinformation on multiple platforms, not only historically kind of with others on Facebook, but also kind of on YouTube. He's had now 2 documentaries. He's written lots of kind of pieces that show up in not mainstream publications, certainly, but those that still get read. And so, I start there, Florian, because while I am thankful also that there's more attention being paid now to the real challenge of misinformation in public health broadly, and especially around vaccines, it certainly is a challenge that predates COVID. I mean, arguably, it also predates. Certainly, arguably predates the internet. I mean, there were kind of misinformation, kind of whispers around kind of the efforts of George Washington to variolate, which was a kind of predecessor to kind of vaccination, the Revolutionary War troops against smallpox. So, kind of people who thought that, it was kind of not what it was actually being said, that kind of it was a kind of secret campaign by the British, that kind of, General Washington had been fooled, right? So we've had conspiracy theories, around vaccines for a long time. It's just that they have been turbocharged, kind of by the kind of underlying algorithms of the social media platforms. And so, kind of what do I think needs to happen, Florian, is that I think the platforms need to do much more than they've already done. I mean, while certainly I already said I was grateful that Facebook has taken, some meaningful measures, it certainly hasn't done enough. It needs to deplatform those that are, and have a history of engaging in and spreading misinformation around vaccines. It needs to be much more robust in its kind of fact checking and in its kind of way of framing the fact checking. But the same applies to Google and to other kind of tech platforms. And then the question about healthcare providers, I think, is also a really important one, because thankfully we now have, real data from even just the last weeks of the COVID-19 vaccination campaigns that people do trust their healthcare providers on the question of the COVID-19 vaccine. And thankfully they trust their healthcare providers, at least relative to other messengers, in a few ways. They trust kind of that that they have their best interests at heart, as their healthcare providers. They trust that they are being faithful to what they believe to be true and what they know about kind of the vaccines broadly. They thankfully trust them when they're talking about specific vaccines. This is increasingly important because we now do have patients showing up to different vaccination sites saying, like, I want the Moderna vaccine or I want the Pfizer vaccine. And so all of that really matters. Unfortunately, there still is this real challenge of how many Americans, and it's not a small number, as kind of recent panel surveys have shown, really still do believe at least one, if not more, conspiracy theories around COVID-19 and the COVID-19 vaccine. So, really kind of people who believe that, it's all a kind of shadow box way for Bill Gates to kind of chip us all and track us, that it's kind of some kind of effort from the government to have kind of a better registry of Americans and kind of various kind of demographic information about each of us, that is actually going to give us COVID, that kind of COVID is a hoax, but the kind of vaccine is the real kind of vector of making us all sick. I mean, all sorts of kind of things that are not remotely rooted in reality. And that actually still remains a challenge for healthcare providers, because kind of the people who have internalized those conspiracy theories, at least like what we see thus far in surveys, while they believe their healthcare providers have their best interests at heart, and they believe their healthcare providers are speaking to what they believe to be true, they believe their healthcare providers haven't yet had the scales fall from their eyes, kind of that their healthcare providers have been duped too, kind of that they know the truth and their healthcare providers don't. And so while I think it's hugely important that we support our frontline healthcare providers, our doctors, our nurses, kind of, other midwives, doulas, like anyone who's really kind of in contact with patients, even outside of a COVID vaccination appointment, with kind of what we know kind of are the best messages and messaging, we also have to ensure that we're not kind of putting our healthcare providers into impossible conversations. And part of that has to be kind of then the public effort around education, and in some ways kind of the crowding out of the conspiracy theories, and then stopping the spigot of the conspiracy theories, which is really kind of why there still has to be further kind of specific pressure, but kind of intense pressure put on the social media platforms to do much more than they've already done.
Yeah, thank you for sharing that, Chelsea. And I totally agree. And I'm very happy you brought up this social media platforms. We have very active here diversity and inclusion groups at Cedar. We call it Cedarversity. And one of the topics we discussed actually in our last meeting was how these algorithms of the social media platforms are dividing the country, because they feed you not what is maybe general knowledge, but literally what do you want to hear? Where do you click on? And that is, of course, very, very dangerous, especially when it comes to life and death.
Well, Florian, I would just say quickly to that, Charlie Wartzel, who is a reporter at the New York Times who covers the tech sector, wrote a really chilling piece a couple months ago after the election, in which he kind of documented his experience of living inside two different people's Facebook accounts for 3 months leading up to the election, kind of one of whom had only kind of had a Facebook group that really mirrored the group that she, in a non-COVID time, would have interacted with still in real space, people that she had worked with when she was a teacher. So before she had retired, her colleagues who she still would see, were it safe to do so, kind of their spouses and siblings, her actual friends from high school and from other parts of her life. And that kind of her Facebook feed was really kind of mirroring what would happen if she were able to kind of interact with all parts of her life on a daily basis. It was updates about people's kids. It was kind of updates about people's retirement plans. It was updates about kind of the vacations people would take if we weren't living in the midst of a pandemic. It was only a couple of kind of political messages. There was no kind of COVID-19 misinformation. And then the other Facebook account that he inhabited really from a gentleman of a similar age, that person had accepted kind of the friend of the friend of the friend of the friend, like there had kind of just been a ricochet. I don't even think it was 6 degrees of separation. It was sort of almost infinite degrees of separation. And kind of he was friends in the way that I think you only can be kind of on Facebook with, many thousands of people. And while once in a while, there would be something from someone he actually had a real relationship with in his Facebook feed, much of it was kind of conspiracies about the election and conspiracies about COVID. So kind of already, even before the election, kind of the ways in which kind of the Democrats were going to suborn the will of the people, kind of, clearly kind of laying the social groundwork for the Stop the Steal efforts that we saw subsequent to Biden's very clear victory, but also deep wells of COVID-19 conspiracies, both about the virus and about the vaccines, even before we had any vaccines that had actually received emergency use authorization by the FDA. And so I say that because I think it so clearly crystallizes what can be good about social media platforms when kind of they do facilitate especially in these moments of kind of us being separate and apart from one another, connections and connectivity, and also what can be so deeply dangerous, especially when we're separate and apart from each other, when they facilitate the kind of continuing kind of rending and kind of ripping of reality, because of how tenuously connected you are to the people in your ostensible group.
Yeah, I think we definitely understand that social media is not going to replace the media in general. And I think the need for also curated content is definitely important for a country. So I'd like to right now talk a bit more about the equity. The vaccination rates, I think, amongst Black and Latino communities have been far below the white communities. Yet these populations have been disproportionately affected by COVID-19. Why do you think this is? And what can healthcare industry do to promote better vaccine equity?
I think we have. I think we know why it is. I think it's partly because of. I would say it's for a few reasons that I don't think are really disputed, Florian. It's partly because of who has access to technology, who has access to people who may enable them to skip the line, who has access and kind of the already kind of tech savvy of knowing kind of when to get online and how to navigate, even if technology itself isn't an issue. It also has to do with kind of where vaccination sites have been placed, so kind of real proximity. I think this has especially been a challenge for more rural communities, and especially then for more kind of rural communities of color in our country. And our vaccination rates, at least in the states that publish them, because I think that's also an important point to make. Many states, at least 20 states, are not actually publishing detailed racial breakdowns of who is being vaccinated. So it's very hard to know kind of what the vaccination status is there. But at least in the states where vaccination rates are being published, and I think we can see this really clearly also in the kind of states where there's a lot of really important demographic data being published. I'm thinking of like Illinois and Chicago, where you can see really painfully the zip codes that have been kind of hit least hard by COVID have received disproportionately kind of the most kind of vaccinations, and those that have been hit the hardest by COVID have received disproportionately the least. I would say the good thing is there are a lot of there's both kind of now like the city infrastructure is mobilized kind of and is trying to do things like stand up mobile clinics and kind of place more kind of vaccination sites in more places around the city. And there are a lot of community organizations, especially community organizations kind of by kind of Latinx, like doctors and nurses and Black doctors and nurses that are doing more kind of personally to close kind of those equity gaps. And that's really what we need to do on a national level, because while absolutely there are kind of real questions about the safety and the efficacy of the vaccine that deserve kind of real answers in many communities, and especially in Black and Brown communities in the United States. It's by far and away an access issue right now, not a hesitancy issue. And, if we think about like here in New York, where I think we both are, Florian, like in New York City, kind of the way New York City is also kind of trying to solve our really egregious, horrific equity challenges, especially kind of from what we saw in the early vaccination data. A few weeks ago, New York City started kind of prescribing that certain of the bigger vaccination sites, would be open only to kind of people who lived within certain zip codes. So if we think about kind of Shea Stadium, it's kind of people who drive taxis and people who live near the stadium. If you think about the Armory in Upper Manhattan, it's people who live in 20 some odd zip codes in Upper Manhattan and the Bronx. And I wish that hadn't been necessary, but given how many people were, I think understandably like desperate for their vaccines, and their families were desperate for their vaccines, but that you had people coming from areas that hadn't been hit hardest by the virus, areas where people are still not, especially vulnerable to the virus, kind of taking those vaccination slots from people living in areas that had been hard hit and where kind of people are still especially vulnerable, particularly if they're living in crowded or congregate settings. I think we are starting to make progress in kind of having a more equitable distribution, but we still have significantly more work to do. But to even know what work we need to do, we need the states to be publishing more granular data and doing it in a more real-time fashion so that we can also have real adaptation, so that we don't have kind of lagging recognition of equity gaps. We have kind of more immediate recognition of equity gaps and then can take the remediation that we need to take.
Yeah, I think it's that's totally right, and it's not, of course, only in vaccination. But I think there's this saying that your zip code says more about your life expectancy than your genetic code, and that, of course, holds true here as well. And that's one of the examples on why literally it is, and that, of course, is one of the very big topics I think our generation definitely needs to make improvements for and somehow fix. Do you have confidence in the Biden administration's ability not only to control COVID-19, but also improve the American healthcare system? So I think we talked a lot about COVID-19, but would love to hear a bit more from you. What do you expect from the current administration to do over the next 4 years or maybe 8 years?
Well, I think clearly the kind of, the most urgent priority is to control COVID-19 and to try to suppress it to as low a level as possible, and also kind of in concert with that, vaccinate everyone ultimately. I mean, clearly, now we have Pfizer Moderna trials on older kids. Unclear kind of when the trials will start on kids 6 months and older. So right now we're, depending on kind of which company we're talking about, we're looking at kind of like 12 to 16-year-olds or 12 to 17-year-olds. So when we get to younger kids is not yet clear. So kind of this is very much talking about adults, but with the hope that teenagers and younger kids will hopefully be eligible kind of to receive vaccinations that have been proven to be safe and effective for their age group. But thinking about adults, I do think this is it has to be the number one priority of the Biden administration. Although thankfully, I think they have proven that they can work on multiple kind of healthcare fronts simultaneously. We've seen that through kind of the reopening of open enrollment to allow people to access health insurance if kind of they were not able to do so from the last open enrollment period because their living arrangements, for example, were disrupted, understandably, by COVID-19 or kind of other barriers that may have arisen. I think, though, it's important to recognize that there are things that the Biden administration can't do. So, for example, it's great that they vacated the Medicaid work requirements, which made me particularly happy to see as someone who was, although I'm a proud New Yorker and have been for 17 years, I guess. I was about to say 18, not quite, but 17 years. As someone who was originally from Arkansas, it was particularly painful to see Arkansas and especially other southern states work to impose work requirements for Medicaid eligibility. The Biden administration has vacated those, but many states have yet to expand Medicaid. And so while I think it is hugely important that we continue to push Biden on all that he has said that he would do, I think it's also important to push him on things that he hasn't yet committed to do, like more fully fund the Indian Health Service, because the IHS, I think it desperately needs to be updated in kind of the way in which its budget works and also its infrastructure. It's also important to recognize that we need to continue to put pressure on other parts of our government, particularly at the state level, and particularly on governors who have resisted expanding Medicaid, because I think now is really the opportunity to do it, during COVID and kind of during the horrors that it has wreaked and ravaged on so many.
Yeah, no, of course, totally agree with you. First things first. And one of our guests in January was Andy Slavitt. And we, of course, were very excited when he announced that he'll be joining as a senior advisor to help there with the Corona task force.
Me too. I was also very excited as a long time kind of fan and friend of Andy's. I was thrilled that the Biden administration had the good wisdom to ask, and that thankfully he said yes.
Yeah, there are a few people, I think, with more kind of sense of urgency and getting stuff done than Andy. So it's great.
But I do want to say, Florian, I do admittedly want to have add one more thing to the last question, which is, while it is and it must be important that we continue to push Biden on everything that he's committed to do on COVID, on kind of having a public option, on protecting Medicare, pushing the states to expand Medicaid, and I do think it's really important we don't lose kind of attention to the global scale as well. So whether that's kind of returning back to kind of pushing for the United States to kind of lead the effort to build kind of vaccine manufacturing capacity around the world as a more kind of robust and durable commitment to kind of global health and global health solidarity moving forward, or whether it is for the U.S. to continue to show support for WHO, especially kind of, subsequent to the Trump administration's efforts to not only withdraw the United States from WHO, but really to undermine the organization in its mandate and in its ability to act on that mandate. I think that's really important too. And I hope that even while those of us who clearly care so much about having more robust kind of sense of American health and certainly centering equity in that we also really recognize kind of what not only kind of should happen, but really needs to happen at a global level as well.
Yeah, totally agreed. Right now, we have a few questions here from the audience, and my apologies if we don't get through all of them, but maybe let's get through one or two of them.
And also, my kids are having dinner in the background, so that's what you're hearing. If you
first things first, that's the most important thing.
They're thankfully doing great, and I think having I don't know what they're having for dinner, but they sound very excited about it. So you're hearing that in the background potentially.
It definitely sounds tasty there. Nobody's complaining. One of the questions here from the audience is, have you seen any promising startups focusing on public health initiatives, and any that you're supporting?
So I have to say the thing that I am most excited about, painfully, is something that is a consortium that the Clinton Health Access Initiative is part of, but we are only part of it. There are many other partners, from around the globe, which is kind of a fewfold. One, it's to really raise awareness about the crisis of the lack of medical oxygen in much of the world. This is work that we started pre-COVID, but it has only become more of a crisis during COVID. So, we've had medical oxygen for more than 100 years. And yet in so many kind of lower and middle income countries, there is very little actually of any kind of medical oxygen. And then the consequence of kind of the absence of this kind of pretty basic resource is that there are at least 800,000, probably more, people who die every year from a lack of oxygen, and whose lives probably could be saved, were there readily available medical oxygen. So these are kind of preterm babies. These are mothers who have difficult labor. These are people who have pneumonia, terrible cases of flu, kind of and things that you are much, much, much less likely to die of, in the wealthy world, even here in the United States, where we have, rather abysmal kind of health equity realities and kind of real challenges, especially if we think about kind of maternal and newborn health. And yet, like, even though Florian, like this is, that was something just happened in the background. Even though, again, like we know what the answer is, right? The answer is to train healthcare workers, whether, midwives, birth attendants, community healthcare workers, to recognize hypoxemia or low, blood oxygen very quickly, to be able to triage people, who need medical oxygen in places where they're able to access it, to ensure that kind of there are kind of available kind of medical oxygen resources there. Now, that's not only like the actual canister of medical oxygen, it's kind of everything that needs to happen to enable kind of the oxygen to literally get out of the canister and like into the person. It's also it is like the infrastructure that needs to kind of be literally embedded kind of in the wall to ensure that kind of multiple ports can kind of be turned on simultaneously. This actually has been a big problem in South Africa and some countries that have some medical oxygen, but haven't had enough infrastructure to support the level of need during COVID-19. So like at CHAI, working with our partners, we're both trying to raise awareness about kind of this challenge, like raise awareness about the kind of few interlocking things that need to happen simultaneously to help really address this challenge, to save truly hundreds of thousands of lives, and that it's not that expensive. So there's some things that we talk about in global health that are expensive. This is measured in the tens of millions of dollars, like not the billions of dollars. Like this should not be hard for the world to do. And so I am painfully, hopeful that this work that we've been working on now for quite a while may actually have real traction because of the COVID-19 crisis, and that hopefully that will enable us, again, with many others, to help save lives of COVID-19 patients, but also save the lives of newborns, of children, of mothers, but kind of anyone who would really need medical oxygen.
Yeah, thank you for sharing that. And maybe one very last question in the last 2 minutes that we have is more about your career and mentors. So you probably had a lot of qualified mentors to choose from, but who have you turned to for guidance or support throughout your career?
I am so thankful to my my doctorate supervisor, a woman named Dr. Nairi Woods, who has been an incredible academic mentor to me, and also just an incredible life mentor. While she herself has been a lifelong academic now for, goodness, almost 40 years, she has mentored people who have, yes, gone into academia, who have kind of gone into the private sector, have gone into the public sector, and then people like me who have kind of gone into academia at times, gone into the private sector at times. Certainly, I'm a very active citizen, but have never worked in the public sector. And she is just someone I could not imagine my life without, and whose advice I'm always really grateful to have.
Thank you for sharing that, and Chelsea, for joining. This was really, really encouraging. Sometimes, of course, very, very deep and a serious topic. It's just the time, but we really appreciate all what you're doing for society with your Clinton Foundation, and of course, taking the time to do this here with us. So right now it's time for dinner for you, probably.
Yes, thank you so much, Florian, and to Bethany, and to everyone kind of on your team. And again, like a final shout out to the Girl Scouts, and just thank you to everyone who joined us this evening.
Thank you so much.